Yay.
Hi everyone, great to see everyone.
Mental
Sorry it's
health.
taking a bit long. I didn't realize it took so long to admit people, which is a really nice sign to see loads of people, but it just took a little bit longer than I expected. So welcome. So thank you to those of you who've been waiting patiently, and thanks to those who are still pinging through and joining us. And it keeps going, which is great. Wow, it's lots of pings. Um, okay, I think we're there. Um, right. Hi everyone. Great to see lots of initials. Hopefully see some faces at different points throughout the webinar. I'm Charlotte Burrows. I'm the Chief Exec of Design and Mental Health Network, and it's yeah, a real privilege to be bringing you this webinar with colleagues today. So Design and Mental Health, if you haven't heard about us, we're a UK charity and we focus on improving mental health outcomes through good design. And one of the ways that we're going to focus on today, and one of the topics, is obviously lighting. We've got just under an hour and a half together. We'll work through our speakers. So firstly, we'll have Dr. Shelley James, who'll take us through the kind of lighting science and human health. Really pleased that Lee McCarthy, from Director of Light Years Ahead, will be joining us to put some practical things into play with real world insight and NHS lighting design. And thanks to Dr. Fanny Burrows, who'll be leading on talking us through sustainability, climate health and net zero with regards to lighting. And Fanny joins us from NHS England and interim head of a trust as well for sustainability. So I can see more people are still popping in, which is great. And I get that it might take a while to work through. So I'll put a little overview in a minute into the chat of the agenda. We will have a chance for question and answers at the end, towards the end of the session. So we've allowed a bit of time for that. If you have questions as people are speaking, by all means put them in the chat. If one of the speakers can answer them, they will do their best to do that after they finish speaking, or if one of the other speakers or one of us can answer, we'll do that. But otherwise, we have got some time in the chat afterwards. And we are recording this, so we'll be able to share slides and get those on our website. So without anything else, and we haven't got any other planned breaks, so please make yourself comfortable, adjust your lighting accordingly, and we shall begin. Over to you, Shelley.
Yay, fantastic. Well, what a privilege, and thank you so much for inviting me to be part of this conversation. And I can see the names of many friends and colleagues in the list of people who are here. So thank you so much for making time on this slightly gloomy Tuesday afternoon or lunchtime. So I'm going to share a presentation, and just a second, where are we? Window. There we are. I'm going to now move into play mode. There we are. Great. Okay. Michelle, I've got my phone near me in case anything breaks down or you can't. So I'm just going to keep an eye on you. So thank you very much indeed. Okay. So by the end of this sort of 20-minute canter through the science of light for the brain, hopefully you're going to be as passionate and as geeky about light bulbs as I am. And yeah, never go into a room in quite the same way again. So it's not going to be any news to you just how much demand there is for mental health services, and it's shocking how many people are really struggling with mental health. When it comes to the design of the built environment, when it comes to lighting, there are a number of guides that people use, and they're very useful. But mostly, until relatively recently, they've been specified for visual performance. So we know what the eye needs, what the average eye needs, and the lighting specifications are for light on the task, mostly not even integrating the way we use technology today, but they're really specified for visual performance. They're also specified for efficiency and convenience. I'm a trained electrician and I've spent lots of time on site. And if you can bang them in quickly and get out of there, the happier you are. We also have specifications for energy efficiency, so what we call lumens per watt. And what's really interesting is that this particular lighting company put the before and after. That one on the second on the right hand side with all that glare is a plus. It's a benefit. So we find ourselves with, thanks to those regulations and those commercial constraints, with spaces for people who are struggling that look a bit like this, or like
Shelley,
this. And some,
Shelley,
yeah,
so sorry
yeah,
to intervene.
please
Just
do.
to check, are you going through the slides? Because at the moment I can just see the title slide, but I don't know if that's
Okay.
just a me
Oh,
thing.
thank you.
Yes,
Sorry.
okay. Somebody else has
Thank you.
confirmed that the slides are not yet moving on, just because you were saying the one on the right there. And
Oh, yeah. Thank you. I'm going to try and do something differently then, because I was moving through slides. So thank you very much for breaking in there. What can you see now? Can you see a picture of a waiting room? Yes.
I can see some coloured doors.
Okay, let's just, can you see a corridor now?
Yeah.
Great. Okay, so
Lots of thumbs up from everyone, so I think everyone's on the same page as you.
marvelous. Okay, so thank you so much for that. So my brother's got a beagle and I'm very fond of them. So mental health is obviously, we all know how much pressure there is. We also, those of you who are involved with lighting design specification will know broadly the rules that you're trying to follow. And you will know that mostly they are specified for light on the task for visual performance. So between sort of 50 and 300 lux, up to 500 or 1,000, but really on the desk, and not even integrating our use of technology. So I mentioned the before and after. So if you look at that picture on the right, you can just see the level of glare coming off what's supposed to be an upgrade. As a trained electrician, I've spent a lot of time whacking fittings in as cheaply and as quickly as I can. We've also got an energy efficiency directive, which obviously is demanding that stuff kicks out more visual light than with minimal energy input. There are some new regulations coming in, which we'll talk about later, which hopefully is an opportunity to do something about this. So we end up with spaces which look like this for people who are struggling, or like this. So somebody made an effort with the murals, but and looks as if there's a sort of a skylight effect thing going on in the corner. But I wouldn't want to spend much time in there, and I'm not sure about you. A bedroom similar, with concerns about privacy, meaning that very often windows are blocked out. Can't we do better than that? Let's hope we can, and I'm going to talk a little bit about why we should. So let's start with why, what we know about how the eye and the brain are working. Many of you will be familiar with this diagram, but essentially the on the right is the retina. It's a piece of brain tissue which starts to develop in the first few weeks of life, and it's an early predictor of mental and physical health issues. Actually, it's a really valuable diagnostic tool. So the back of the eye, we've got the visual system, the rods and cones, which filter the information from that lot, filters up through the retina to the top layer, where it's gathered up and then sent back the optic nerve to the visual cortex at the back of the brain. What's interesting is that about 20 years ago, scientists who were trying to work out what was going on with people who were blind and partially sighted, separated the rods and cones, that visual system, from that top layer, which they thought was just a relay station. But it turns out that about 5% of that top layer is actually signaling independently. So they called it intrinsically photosensitive retinal ganglion cells. So yeah, it fires off on its own. And it sends signals directly to the top of the brainstem to a whole bunch of really important systems which regulate hormones, mood, alertness. So you may be familiar with SAD lamps. It's that pathway which is driving mood, so mood regulation. It's also driving the sleep-wake cycle and a bunch of other stuff, which we'll talk about in a second. And that pathway is responding to a massive shift in brightness from the morning up into the day and then crash again in the evening. So it's responding to that massive range. And you remember we looked at the range that we normally get indoors, and what we normally get indoors is just a fraction of what the brain needs to feel happy and healthy and alive. It's also responding to the full electromagnetic field, and it's becoming more and more apparent that things like infrared are absolutely critical to brain function to retinal function to a whole bunch of other stuff. So that's another component that the brain and your eye evolved to optimize for. Part of that is, so very often we think about the visual spectrum, and it is, I mean, yeah, that's the spectrum of daylight. So the brain is looking for that range of wavelengths. And that system is optimally sensitive to sky blue, which is perhaps not surprising because it's designed to respond to a daytime and daylight environment. And the protein in that little system that fires is called melanopsin. So those of you who are familiar with lighting specifications and design will see a new number coming through into the standards called melanopic lux. So it's almost like coffee for the brain, and we'll talk about that in a minute. So the other thing that the brain is looking for is dynamics. It's looking for that shift in color, temperature, and quality of light through the day and into the evening. We could talk about nighttime, but actually we're going to focus on daytime for this conversation. So we know that outside is best, but for many, particularly those living in residential healthcare, it's a luxury, right? Of those who could actually get outside, only 1 in 5 actually went outside daily, and around a third only went out less than once a month. So, so what can we do? Windows can help, and that's the view from my window where I can see here, and I took that reading a little bit earlier today. Can you see how even on a rainy day with old-fashioned glazing, we've got a full range of wavelengths all the way into that infrared? And when we look at what that means, we see when people have access to a window, it reduces sick leave in offices, it reduces length of stay in hospital, not only in terms of one's perception of whether a space is healing, but also whether it relieves stress. So daylight windows, for anybody who's designing these spaces, see if you can get access to a window. It even improves morale for nurses. So with the same light level, the ability to see outside and connect with nature made a difference to markers of stress, but also just communication and laughter. And Lord knows they need as much help as we can give. So daylight, gold standard, right? But what can we do with artificial lighting? And we'll hear more from Lee about the kind of technical dimensions of this, but I'm going to talk a little bit about how we think about artificial lighting from a therapeutic perspective. So I mentioned earlier the range of wavelengths that we know have the critical alerting factor for the brain. So things like SAD lamps, around 10,000 lux for half an hour. There is a dose response curve. So less light, a lower lux level for longer seems to have a similar effect. So we think about, and it needs to be that sky blue has that alerting effect. Full spectrum is good. So when we find ourselves with old-fashioned, there's a daylight, I'm going to compare spectrum now because that's one of the key components in good quality lighting going forward. So daylight has that full spectrum, incandescent has a very particular spectrum moving towards the reds. But most spaces that we are now involved with have either fluorescent, and look at the spectrum there, it's very sort of peaky and the brain doesn't get the information it needs to make sense of things. Cool white LEDs, the standard cool white LED, and every time I go into a hospital or an office or a waiting room, we see those cool white light bulbs with a peak in the blue, which is supposed to wake you up, but it's lacking a whole bunch of other stuff that your brain needs to feel comfortable and process correctly. Again, even a warm white LED, it might look yellow, but actually it's missing a bunch of spectrum, the bits of the spectrum that the brain needs. Now it's becoming more and more affordable and more accessible to use what we call a full spectrum LED. So the chip in the light bulb is engineered to deliver, it's not getting any of those infrared, but it's certainly getting a broader range of wavelengths. So when people talk about full spectrum, have a look with a light meter if you can, and look at the range of wavelengths that are coming out of that light source. So we're going to talk just briefly now about what that means in terms of lighting applications. So I divide this into 3 broad layers. We've got tunable, so it's a light source or several light sources in a room where you can change the appearance. We'll put dimming to one side, but let's look at tunable. So we know that bright, cool light is as good as a cup of coffee without the side effects. So going outside after lunch, for example, if you're feeling a bit dopey, or if a client is feeling a bit dopey, having a conversation next to a window outside is as good as a cup of coffee. Bright light is actually as good as an antidepressant in those therapeutic doses. So combine light therapy with antidepressants, it boosts the effect, and it can even be protective against some of those risks with seasonal affective disorder. When we look at that actually in the field, we see some really interesting results in residential care. This is a project with some people in Denmark. Interestingly, we know it works because if they keep the light on in the evening, it keeps them awake. So it's definitely not the placebo. When we apply this to particular therapeutic settings, postnatal depression, we can see things like bright light therapy having a really significant effect. Even things like eating disorders where we see a circadian effect, it seems to change people's behaviours in some really important ways. And that's a personal interest of mine. And I think using these therapeutic effects could be really important. So at the other end of the spectrum, warm, soft, warm, campfire effect, we see a significant effect on people's ability to kind of handle conflicts differently. We tend to feel people are kind of kinder and more sympathetic, sympathique in warmer light, even if the facial expression is neutral. We can use this understanding. You can see the lights are the same, but simply by tuning the knob, you can change people's level of activation or stress. This is a recent study looking at willingness to seek help in primary school kids, a big study in China. What was interesting was that particularly those who are field dependent, so who kind of care more about what other people feel about them, they felt as if this softer, warmer environment made a difference to their willingness to go out there and get some help. But even in those who were less engaged or found it harder to reach out to other people, it still made a difference. Being able to simply, particularly in an environment where you feel a little bit out of control, being able to change the light settings makes a big difference too. So just the ability to access the knob makes a difference. It's just going to talk briefly about setting the body clock, which is another. So we've got that mood and behavior dimension, and then we've got this body clock dimension. So this is where some people call it dynamic. Well, dynamic is where it's got an automated dimension. Circadian is a subset of that, where we deliver enough light to set the body clock and enough darkness to set the body clock too. So yeah, as I mentioned, darkness is as important as light. We now know how much light an average person needs. Everybody is slightly different. We now know an average, and that has set the benchmark for current, what we call circadian lighting specifications. We also need to make sure that the light in the evening is dark enough. I keep on banging on about darkness because it's very tempting to forget the importance of that contrast. So one night under 100 lux, so a standard light bulb, is enough to shift the way your body clock is working, the way all sorts of things in your body is working. And particularly for adolescents, they're twice as sensitive to light after dark, and even to the same melanopic lux, that color temperature, that visual experience of something that was brighter and cooler made a big difference to that melatonin suppression, that hormone suppression. When scientists are using light to set the clock in teens who tend to struggle more with setting their body clocks, some really interesting effects. So those who run spaces for teens or adolescents, controlling light exposure makes a big difference, their ability to get some sleep and then for their brains to form correctly. Major depressive disorder, seeing some really valuable effects there, sleep efficiency, sleeping longer, waking up earlier. Schizophrenia, reduction in what they call BPRS scores, so yeah, and suicide ideation, a bunch of really important effects when we concentrate the light exposure in the time of day and the darkness. In dementia, I'm doing a lot of work in residential care, and again, seeing some really important and valuable results in ability to manage mood, but also to manage functional behaviour and agitation. Those of you who work in hospitals or spaces where people actually need to be alert during the night, you can use a dynamic light setting to essentially create a false day by using what we now know about what the body clock needs. So not only do we see improved performance during that shift, but also through into the day after, which can often be a problem. even in offices, it seems to make a difference. And of course, there are many of you here who have, giant teams of admin staff, and that makes a big difference too. So what you see there on the right is a kind of a standard curve for delivering that melanopic entrainment. So the question, does lighting really need to look like this? Now we know what we know, and now the technology is available to do something different and better. Many people are kind of feeling very gloomy about the new version of Part L, which is the government regulations about lighting efficiency. And of course, we've got the NHS net zero. But actually, we could say that it is the perfect opportunity to upgrade the lights, because not only by adding those LEDs and just retrofitting like for like, once we start to integrate this new understanding of the need for the right light at the right time and quality of light, and enable a certain level of, well, not only daylight, but also personal control over the lighting conditions, we can really start to see a win-win-win-win. So I'm going to stop sharing now. Hopefully that has kept you all awake, and thank you for your time.
Thanks. Thank you so much, Shelley, for taking us through that. A lot of information, but really, really clearly articulated. I feel like I learn a little bit more each time we go through it. So thank you. I'm going to hand over now. Hopefully, Lee's been dealing with technical difficulties, but hopefully I'm going to hand over to Lee McCarthy, who's Director of Light Years Ahead, and is just going to take some of these principles and really kind of share some real world insights and help make it practical, because I recognise a lot of people on the call. It's the opportunity to take some of the learning and translate it into the environments that you're either designing or delivering services in. So hopefully, otherwise I'll be doing a rapid speaker change, but hopefully, Lee, if you're there.
Yeah, hopefully you can hear me.
Yeah.
Good.
Brilliant.
Apologies you can't see me, but as I said on the chat, probably better that you can hear me rather than see me anyway. If I try and share my screen as well now. Is that okay, or is it showing the presenter?
It's just coming through.
I can see your title slide, Lee.
Perfect.
So far, so good.
And it's moved on. Perfect. Okay.
Yes, moving on.
Thank you, Charlotte. Thank you, Shelley. I don't know how to follow that. I won't talk about the science behind it, because Shelley did such a fantastic job and knows far much more about it than I ever will. But Charlotte said every time I talk to Shelley as well, I learn something new. So it's all good. So to start off with, I have a question for you all. What keeps you awake at night? Is it blue light, as we've just heard about? Is it worry about lighting in your facility? And what barriers do you face in your own facilities when considering lighting upgrades? Is it budget, risk, resistance to change, or something else? So as I sort of go through my slides, I just want you to sort of bear those questions in mind, and then perhaps we can, at the end, you might have a question, or you might be able to answer that question. So as we've just seen, lighting influences far more than just vision. It can regulate alertness, mood, and we can align lighting with the natural circadian rhythms to support well-being. So along with our partners in Australia and the Monash University, they developed a system called melanopic. This can help increase alertness, improve mood, and give a higher quality sleep. So melanopic in practice, during the day, melanopic has a blue enriched light at 4,200 Kelvin, and as Dr. Shelley talked about, the melanopic lux 4,200 is shown to be sort of the sweet spot for that. So it's a blue enriched light without appearing blue. Some systems, 6,000 Kelvin, the actual everything looks blue because the light is blue, whereas with this one it's 4,200. It's more of the sort of office lighting, but with blue enriched, so the peak is in the blue area as sort of shown on Shelley's slides. And then at night that sort of dims to a 2,200, so much more like candlelight, firelight, incandescent light. But at both ends of that spectrum, the CRI is really good, so it is hitting the sort of all of the colours. So colours still look good, and you're getting that full spectrum at both ends. But at night, the important thing is blue depleted. So a typical cycle would look like this. This can be pre-programmed, but the service user can also have control over the lights. So during the day, we recommend the Melanopic blue is in, at full brightness throughout the day, no changes. We can regulate it with, if there's natural daylight, we can dim it down, but we say, we don't want to mess about too much with the light during the day. In the evening, we then transition sort of 3 hours before sleep. So we go from that blue enriched light to the blue depleted light, and at the same time dimming that down as well. And then 2 hours before sleep, we sort of get to that 2,200 with the blue depleted light, which will help. So if we compare the Melanopic system to sort of existing human-centric lighting or tunable white or circadian rhythm systems that are out there, they still use the blue LEDs coated in phosphor. So although they may appear warmer at night, the amount of blue light is still relatively high. Again, that was sort of shown in Shelley's slides, where some of the incandescent lamps were, or sort of the LED replacement for incandescent lamps still had quite a high blue, even though they were warmer, and sort of missed out on some of the other colours needed as well. So while this can create a visually dynamic environment and an emotional response, it does not guarantee biologically meaningful results. Without specifically managing the blue spectral content, such systems can fall short of supporting circadian health. We believe that service users should be in control of their own space. So most people would have multiple light sources in their bedroom and also have the ability to dim and change the colour of the lights. With the Luca fitting, which is mounted on the ceiling in this image, and the Resistlux bed head, which is mounted over the bed, we've tried to arrange that use direct and indirect lighting that can be dimmed, and also use the Melanopic system to change colour. We can also use RGB colours during the day in many of the fittings. So for example, in the Resistlux bed head, we could have this as RGB colour changing, and this can help to calm or stimulate where needed. At night, the upward light element of the Luca can be used. So if someone's lying on their bed, trying to read a book or watch TV, it wouldn't be too bright or glary. And the upward light element can also be used as a night light. So again, this would hopefully stop too many disturbances. If someone's on observations and the light is turned on, even if it's dimmed down, it could potentially wake someone up. It comes in 3 different sizes, so it can be used in different spaces to create different effects. And as you can see, you can have it fully illuminated, just the down light or just the up light. And again, it can be dimmed, color change. We've tried to develop a range of products that complement each other and can be used throughout the facility, from the bedrooms, bathrooms, through to corridors and shared day spaces. And they're also at different levels of anti-vandal and leakage resistant, so depending where they are. But from a maintenance point of view, use same LEDs, the same drivers, so can be upgraded quite easily in the future to make life easier for the estates team. But don't worry, they don't always have to be finished in white. we can finish in any of these standard colours that we offer, and that can be for one fitting or 100 fittings. Quantity doesn't matter. And if none of these colours quite match what you would like, then we can finish in any RAL colour. Just let us know what it is, and we can do that. So these colours are sort of there to either complement or contrast against existing decor and furniture, make things a little bit more interesting. And again, not just finished in white can feel a little bit institutional, and it's obviously what we're trying to move away from in the design of the product, the quality of the light, and down even to the colour of the light fitting. We also have a wide range of fittings for emergency lighting, from bulkheads and exit signs through to discrete standalone fittings. The standalone fittings, the small surface and recessed fitting, we can also supply with a feature that switches off the green indicator LED at night, so it doesn't disturb people, or they might think it's a camera. On recent projects, we've also put that indicator on the outside of bedrooms, so again, that green light isn't disturbing people. If you stay in a hotel and it's got an emergency light in the room and there's green light on all night, that can keep you awake or disturb your sleep. So again, it's things we're thinking about moving forward to try and make the experience better for everyone. And then as part of the control system for the lighting, we can include presence and daylight detection, so that we can dim the lights down when no one is around, or if there's enough natural light, as I mentioned earlier. But then we can take that further. So with our partners at MyMesh, we can use those same sensors as backbone to potentially control other things, such as the emergency lighting reporting, so that someone doesn't have to walk around and do it. They'll be alerted if there's an issue. Heating and cooling, air quality, water monitoring and control, asset tracking, space utilisation. This system is already being used by a number of NHS trusts. And if you'd like more information, just reach out to me and we can discuss it. So in summary, we need to make sure environments are safe for vulnerable individuals, but while still trying to support healing and dignity. Wellbeing and rehabilitation are important elements that are often overlooked with existing specifications. And imagine the benefits that could be generated by illuminating permanently occupied spaces, such as within mental health care, via science-based lighting solutions, where the residents can benefit from restore and maintain wake-sleep cycles and all of the documented benefits of a healthy circadian cycle. So again, I'll go back to the original question: what keeps you awake at night? And is it the lighting in your facility? And if so, we'll be happy to try and help with that. Thank you.
Thanks, Lee. Thanks for taking us through that. Really great. It's always takes the theory and the evidence and then look at the practical. And I can see there's a few questions building up in the Q&A. So where our speakers can, they'll try and answer those. If not at the end, they'll try and answer them during the session. Right, I was about to say I'm just going to hand over to Fanny, but I'm just going to make sure. I just seen she's rejoined. So Fanny, are you online and with us? I'm just checking in a minute. Sorry, excuse this. Fanny, are you with us? Okay, well, Fanny's not with us at the moment. Something must have happened. She was on the call. Can I just maybe, what I'll do is I'll just turn to some of the Q&A. So Lee and Shelley, if that's okay, we've got some Q&A in the chat in the Q&A section. So I wonder if while we're waiting, we'll just take some of those, if that's okay.
Yeah, sure.
Sure. Yeah, I was actually just typing to response to, is it Tava or Tiva? Anyway, sorry, I was just sort of typing one of them, but please go for it. Charlotte, you tell us who should
I'll
go
read them
first.
out. So, given the undisputed importance of lighting on an indoor environment, why do standard NHS procurement processes usually entail lighting that is specified by electrical engineers or electrical subcontractors who focus on lighting quantity and cheapest specification, not lighting quality? And brackets, sorry if I'm treading on toes here. So how can we move to the specification to designers or people who understand and care about improving lighting? How can we implement this and put this into practice? It's a big question.
Yeah, I'm just going to respond as I mean, in my experience, the projects where I'm seeing some really great installations is where the client, the end user, decides they're going to kind of take the specification and hang on to it and not let go and not let it get value engineered. So there are ways of shifting the procurement process, but it does take a kind of personal campaign, and sometimes it can be quite bruising. And speaking to people like the team at the RNIB, where they were able to really make a massive difference to the way that the lighting was specified there, even though the tendency was for it to go to an M&E contractor. They've been able to get some really great results by simply not letting go. So my encouragement to you is to decide that you care, and just stick up for that change, and get other people in there, people like Jean Hewitt or myself or others in the space who are on hand to help you to fight those battles if you're ready to do that. So yeah, I think it is possible to change the normal process if you decide that you're going to fight, really. I wish you didn't have to fight, but you do. But once you do, it works. That's my response anyway.
Great, thank you for that. And then Megan's put in, it'd be great to know if there are any official standard guidelines for melanopic lux, as we're aware the latest LG2 is silent on this.
I'll just jump in and ask that. So the current standards, they were defined by a group of scientists who met in Manchester in 2019, and they published a paper which is sort of the standard recommendations, and all of the current recommendations through the WELL and other standards are, and even the new EN 12464-1, which is the office standard, reflect that. So it's 250 melanopic EDI during the day, certainly at least 4 hours in the morning, although that number of hours is contested, but essentially for a chunk of the morning. Less than 10 lux, melanopic lux in the evening, and then less than 1 at night. And the projects I've been working on, where we've been applying that sort of rule, which we call the Oxford rule, we've been getting some really great results in residential healthcare, certainly. So that is the standard. As I said in my presentation, it hasn't yet fed through to LG2, but hopefully it will at some point.
Great, thank you. I'm going to pause there and just see if Fanny, who's had problems online with power cuts, if she's back with us. So let me just check. Fanny, are you with us?
Yeah, I'm so sorry, Charlotte. I'm back.
No, not at
It
all.
just dropped. I had a complete moment where my computer froze and I lost everything. I'm really sorry.
No, not at all. These things happen, and yeah, it's we've been keeping ourselves busy with plenty of questions, and we'll go back to those after your time. But while we've got you, welcome. Thank you for making the time for us with your joint hats between NHS England and Frimley Health Trust, and we're really delighted you're going to give us a few different perspectives on light, sustainability, and climate. So I'll leave it over to you.
Brilliant. Thank you very much, Charlotte, and good afternoon, everyone. Pleasure to be here. Sorry for the slight delay. Hopefully my computer behaves and you'll see my presentation in a moment. It seems to be coming through.
Yeah,
Right.
Yeah, it
Fab.
looks like we can see it, Fanny. Looks great.
Great, thank you. I'm just checking because technical issues this morning. Well, it's been such an interesting session today, hearing about the science, innovation and technology, and I find this really insightful, particularly being able to bridge technology, health, and care, and that's something that I'm quite passionate about, actually, making sure that, you know, technology innovations can actually improve patients' health and experience, and sort of bring more satisfaction. But I'm here today to actually bring the kind of environmental impact perspective, particularly around the topic around lighting. And I come from NHS England, as Charlotte said. I work in the National Green NHS programme, but I'm also supporting a trust as the interim head of sustainability for a period of time to support a number of projects, including capital projects, you know, within estates and facilities, and a number of kind of strategy around building green plan and sustainability strategy, generally speaking. What I wanted to do to start with is give you a little bit of an insight of Green NHS, what the National Green NHS programme is, and you know why I'm here today, and hopefully that's going to be interesting. And then I'll get a little bit more into the topic around sustainability, particularly around lighting and healthcare. So first of all, what I wanted to do is start to explain why this is an important subject, talking about sustainability, environmental sustainability, and net zero. And for those that may not fully understand what net zero means, we actually mean reaching a zero balance between the gases, the greenhouse gases that are emitted and those that kind of absorbed, and that's what we mean by net zero. And also try to sort of give you a little bit of insight in terms of why it's important from a health perspective and a healthcare NHS perspective. So I think the first thing to say is, and I think everybody is probably well aware that we're starting to really see the impact of climate change. We're facing some of the warmest years and some event of extreme weather. And the temperatures are rising, and there's clear evidence now that we're around 1.1 degrees above pre-industrial levels. And we agreed to the Paris Agreement that was adopted in 2015 to limit global warming to well below 2 degrees Celsius, and actually with a target of limiting excess at 1.5 degrees Celsius. And currently it looks like the trajectory is going to exceed this target, and for people working in the sciences around climate change and sustainability, and people like me, we are worried because we know that climate change has got a really severe impact on health and on the population. And the relationship with health is really, really important here to understand, because we know that climate change has got a dramatic impact on health. It's accounted for excess death. So if we look at some episodes of the heat waves, particularly in the UK, and them alone have been associated to over 2,500 deaths. We also know that air pollution is a huge threat to health, increasing respiratory and cardiovascular diseases, and accounting for 1 in 20 deaths. And, you know, increased sort of conditions such as asthma, stroke, and different diseases. And we also know that it's got a worsening impact on some of the most vulnerable but also disadvantaged populations. You know, just looking at how the communities are living, where they're living, and have that kind of worsening impact on those populations. So this is quite sort of a sort of severe impact, and note as to why we really need to do something about it from a health perspective. And I'll probably go into more detail around the impact on healthcare and healthcare delivery a little bit later in the talk. Now, if we go back to NHS only, I don't know, can you see my notes on the side? Because I can, and my screen is quite small, so I was just wondering.
No,
If you
no,
can-
just seeing the slide, Fanny.
Oh, perfect, brilliant. It's just me then. Thank you. So the NHS alone is contributing to around 4 to 5% of the emissions, the greenhouse gas emission in the UK. And just from a public sector perspective, that's around 40% of the public sector emissions. So this is huge. We're talking megatons carbon equivalent. And we know that the NHS has a huge part to play to try to reduce greenhouse gas emission, but there's also a huge amount of opportunities to try to find solutions to reduce greenhouse gas emission and try to meet as much as possible these targets under the Paris Climate Change Agreement. These got dual benefits, obviously, from reducing emissions and meeting the Paris Agreement, but also improving health. And that could be life saved from reducing episodes of severe weather impact and events, but also improving air quality, therefore reducing some of the conditions through, for example, more active populations. And that's something that we really look into from an NHS perspective of modes of transport, how patients, staff and visitors travel to healthcare facilities, but also from healthier diets. So huge amount of opportunities and huge amount of opportunities to improve health as well and reduce emissions. So I'm sitting there sort of having probably exposed some of the quite dark side of climate change. It's a reality, but also there's huge opportunity to be part of it and do something about it to improve health and make sure we minimize the impact on the planet. So how the NHS is doing this is through a strategy that was published in 2020 and is the Delivering a Net Zero report. The NHS has got two major, really high-level commitment and goals. The first one is to reach net zero by 2040, and that's for the emissions that we control. So that means the fuel that we burn on site, the electricity that we use, the anesthetic gases that are used on site, or emissions coming from inhalers and things like that. The second major commitment is to become net zero by 2045 for those emissions that we actually influence. And actually that's all emissions by 2045, but that also includes the NHS Carbon Footprint Plus. And within that, there's specifically emissions from our supply chain. So if we think of all the suppliers of, products, medical devices, medicines, digital products, everything, and that's something that we can work with and influence, but also kind of the travel aspect. So that's the kind of two major targets that the NHS aims to achieve. And we've already got progress, and I've just highlighted just a few very sort of quick ones to give you a little bit of insights, because sometimes I get questions of, where are we? Are we on trajectory? And there's really good examples. So first of all, that kind of NHS carbon footprint sort of more directly controlled. We've decreased by around 14% since the publication of the report in 2020. And it's things like, focusing on the medicines that we use, reducing anesthetic gases emissions, better respiratory care, optimization of medicines prescriptions, looking at, travel and transportations and things like that. So a huge amount of efforts have been done there. In terms of the NHS Carbon Footprint Plus, that's a little bit more difficult, especially coming back from the pandemic and increased activity overall to try to sort of recuperate from the pandemic. But over the 5-year period, we've seen a reduction per kind of pound spent. So there's really good signs of the work being done to reduce the carbon footprint plus. And as an NHS kind of system overall, we also have got really good signs. So first of all, we've got a net zero that is being embedded into legislation through the Health and Care Act 2022, mandating NHS trust and systems to act and have commitments towards net zero. Every NHS trust and ICB now has a requirement to have a green plan in place, setting their strategy and the work that they need to do to meet this commitment. And we also have work with the care quality commissions, embedding sustainability within the regulation. So huge amount of progress and work being done to support those net zero targets. Now, what are those emissions looking like? And you can see I don't aim to go into details, and this is actually a revised pie chart of where the emission sits within the NHS. It might be a little bit small, you can see it. But there's a lot of emissions sitting within the supply chain, as you can see, you know, the medicines, medical device, and other supply chains. But what I wanted to sort of make sure that you can see is that kind of building energy sitting here at 11%. And within that, we know that the energy being consumed in sort of healthcare settings, and whether that's, you know, acute hospitals, community sites, etc. And obviously energy and lightings also go hand in hand. So just wanted to kind of, you know, bring the kind of scale of the problem and what we're trying to target and resolve. Now, going back to the Green NHS program, the program is very much sort of split into different areas of focus. One of it is around energy optimization, you know, the gas that we use, fuel we burn around estates and facilities, but there's also a lot of focus around travel and transportation, whether that's staff travel, business miles, but also patients and visitors, ambulances, etc. A lot of work on medicines and reducing emissions from medicines, looking at the overall supply chain, looking at the food and a kind of nutritional aspect of the food that we serve. A lot of work on research and innovation, and how research and innovation can support us towards our net zero targets and sort of identify the needs of the future and also to bring the technologies that support us with reducing carbon emissions. Looking how we deliver care and as the models of care. So how do we reduce emissions associated with the care delivery, providing care to patients? There's an element of digital, both from supporting a digital transformation, but also minimizing emissions associated with that digital transformation from a hardware, software, digital services perspective. And then, of course, workforce engagement. And to be able to deliver on our net zero commitment, we need to make sure that we bring our staff, the kind of 1.3, 1.4 million staff in the NHS, bring them along on our journey and offer them opportunities to understand these commitments and to act. And then, of course, the adaptation piece. How do we adapt our healthcare setting? How we adapt the NHS to the threats of climate change? So this is kind of a snapshot overview, but what I really want to do today is make sure that I kind of focus a little bit more on estates and facility, particularly from a lighting perspective, and then talk to you a little bit more about adaptation and resilience. From an NHS perspective, there's been a number of documents produced in kind of 2022, 2023 around how do we deliver towards the net zero estates and minimize carbon emissions. And there's also a document that was produced called the Net Zero Building Standards, sort of highlighting all the different steps into, you know, building and providing standards to be able to meet those net zero targets and sort of build with that in mind. There's lots of different recommendations, and I don't necessarily want to go into them because this is not about how we fully reduce emissions within the estates, but very much sort of highlighting that there's a component here around energy and lighting. And if we think in the context of old NHS estates, there's sort of a move from old lighting systems to kind of new low energy, low maintenance LED lighting. And that very much provides opportunity to reduce energy use, electricity use, and therefore reduce emissions. So there's kind of this link between lighting and sustainability. There's a sort of direct link. But I think there's a really critical component on the how, going back to Shelley's talk earlier, which is, I think, really important when we bring that in the context of healthcare setting and patient care. So now focusing just specifically on the kind of link between the lighting and sustainability, as I mentioned, energy consumption directly linked with the emissions, the greenhouse gas emission, and reducing energy consumptions reduces our gas emissions. So we've got a real interest on the sustainability agenda to look at how energy is being used within healthcare environments. We also know, and I think this is sufficient evidence that we've heard already today, that lighting is really important, not just for patients, but also for staff to deliver care. So we really need to think about how this kind of switch or change to LED lightings are being considered. And there's lots of solutions. So, you know, switching to LED lights will reduce energy consumptions and actually save money. So we've got huge opportunities there. But actually, we don't just need to think about it in terms of just switching to LED. We need to think about enhancing the natural light and, I guess, harvesting the light. So do we need a special amount of lighting during the day when actually we've got a lot of daylight? And that's where we've got really interesting technology around occupancy. So do we need as much lighting when there's nobody in the room? So that's where sensors can be really interesting, that will reduce energy use if nobody's in a room, a meeting room, a specific sort of space. But also control, where light can be dimmed or the light level can actually be controlled depending on the amount of daylight being introduced in the room. There's also some solutions and consideration around lighting in relation to safety and efficiencies, especially when we think of care delivery, but also safety. You know, we think about corridor and dark space, and we don't necessarily want patients and staff to be walking in really dark spaces. So there's lots of consideration where we need to think about efficiencies and safeties together when we think of lighting projects. But all these potential solutions represent fantastic opportunities for the future. First of all, I think being able to develop business cases around potential light switching and moving to LED. And the figures really add up from an environmental impact perspective, but also from a financial perspective. And by reducing energy consumption, the healthcare environment can actually obviously reduce their bills from electricity. So the figures will add up, and it's really worthwhile looking into it. There's also opportunities to access some funding to be able to undertake some LED switch project or consider what sensors or intelligence system and Internet of Things can bring into these lighting projects. And it's really important to consider the requirements in any new build or building retrofit, in fact. And is it worthwhile to start to think about whether we want to integrate some sensors that will be able to sort of measure occupancy, that will be able to measure the kind of amount of lights currently being delivered, you know, whether there's an asset management piece where the estates team can actually track the assets and know when they've got to maintain them, when they've got to replace something. So there's huge opportunities there with new build and retrofit. And just thinking about, you know, that kind of emission, energy and net zero piece anytime that we design something, because there's huge opportunity and co-benefits there. So now I wanted to move to the adaptation and resilience piece. And again, that's probably going to go into something that is a little bit dark. But I really like to think about this, not just kind of reducing emissions, but actually thinking that we're dealing with healthcare setting that have got to face extreme weather events, increased heat waves and overheating events. And we know this, we've got more severe flooding, storms, more frequent and severe heat waves, and those have got an impact on health. We've got more incidents of overheating that have been reported and almost doubled in the last 5 years. And I guess all these kind of extreme weather events and climate change generally can have a risk on operational delivery into health services and healthcare delivery. First of all, because we've got people that are impacted by climate change, and also, so, you know, expressing earlier, coming back to my point around increased respiratory conditions, increased cardiovascular disease related to climate change, but also more presentation, for example, during heat waves. We've got more patients presenting to healthcare services. But also has got an impact. So if we think of, for example, an event of overheating, and that can actually link to cancelled or disruption within a delivery, so cancelled surgery or cancelled appointments, disruption in travel, which means that a patient or staff may not be able to attend the healthcare setting. But there's also a quite stark example of an overheating in 2022 that led to the digital infrastructure in a major hospital in London to go down. And the emergency IT system were only restored 5 days after the event, and the full recovery of the digital infrastructure was retrieved over several weeks, and that led to a number of treatments being delayed, procedures being cancelled, and then leading to a backlog. So that had a dramatic impact actually on healthcare delivery. And then just going back here is just a few examples of the impact of climate change and how that can sort of really impact through heat, for example, physical health and mental health, but also the kind of severe weather events. The heat and the air pollution can increase at different conditions and increase the demand on healthcare services. And there's a number of reports that demonstrate that with clear scientific evidence to demonstrate the threat to healthcare and to our health. So these are the kind of facts and what we've got to consider from climate change and adaptation perspective. But there's also huge opportunities. So I guess it's really important when we think of, you know, the design and some of the projects we undertake within healthcare settings, where we can kind of maximize our opportunity to adapt to climate change and make sure that we bring the right sort of lighting systems and projects into it. So we can, for example, consider the daylight harvesting that is done through the windows and actually move the lighting away from those windows. We've got to make sure that we've got this interaction with natural and outside environment. And we know that's better for patient care and recovery, but also from a mental health perspective. But how do actually our healthcare setting interact with the outside? And how do we make sure that, you know, increased overheating events don't impact this kind of design and access to daylight? And that can be done from a lighting perspective, again, going back to, you know, adapting to the surrounding and bringing intelligent systems and sensors into it. And also preventing the light pollution, I think I would say, where we kind of bring over lighting within specific settings that can have an impact as well on staff, patients and visitors. But it's very much thinking of, you know, how do we actually adapt to climate change in all this kind of design and lighting project that is really key. So I think that's all for me. I'm probably going to pause there, and I don't know if there's any questions, but I just wanted to thank you and turn back to you with any question. Thank you very much.
Thanks, Fanny. That's brilliant, and we will we'll move to questions yeah in a second. Yeah, fantastic. Thank you to all of our speakers. I was like frantically trying to think of all the different kind of themes, but maybe if we start with kind of, yeah, first a shout out for lighting, and thank you for all coming, because I think it's been said that it's on a journey, lighting in healthcare, and from being undervalued to hopefully today, and through the work that you're all doing to being really recognised, the important role it plays. Thank you for Shelley for kind of taking us through some of the science behind lighting, but also getting us the question isn't just about kind of lighting by compliance. It is about how a space feels, and how people can adjust the environment to their need. Recognise the kind of practical element in really tight budgets. How can retrofitting make a big difference? How can we use the evidence to introduce what seemingly are quite small changes but quite significant ones? Hopefully today I can see we've got kind of a real range of audience, so range from clinical and estates to designers, and also people with lived experience in terms of making lighting design and decisions. And today is the start of, many more conversations. We will have Fanny, Lee, and Shelley at our conference in June in Design and Mental Health. So please do have a look at the conference and come and join us for 2 days of talking about not just lighting, but across a range of subjects around mental health, environments, and how we improve those outcomes in healthcare. I think that's probably where I've kind of got to with my summary piece, apart from to say, yeah, we'll have a look at the questions now and see what kind of everyone else has come up with. So if I just have a quick flick through, I see we had quite a lot earlier. So I'm going to try and if people want to raise their hands, I'm really happy to try and, if I can get people off, as long as I can get people off mute, I'm happy to take some in-person questions and make it more interactive as well. But I'll go to the Q&A and start flicking through. Lee, you might want to get in there. There's some practical ones around installation requirements. Okay, from Leanna, I've read some data about LEDs being unhealthy in some ways and was wondering around a take on that. Oh, Shelley, you've answered that one. Apologies, but maybe you want to just share your response just for the benefit of everyone else who's joined us.
Yeah, yeah, it's not great. And the more we understand about how things like those non-visual wavelengths like infrared and ultraviolet are absolutely critical to kind of healthy function, the more we understand that particularly a lack of access to daylight and electrochromic or infrared blocking glazing is really kind of placing our fundamental systems at great risk. In fact, there's a great Huberman podcast with Glenn Jeffries, and he likens it to the kind of ticking time bomb of asbestos. And that really it's only been the last 10 years or so that we've been living, relying so heavily on these artificial light sources, particularly not only during the day, but also kind of crashing into a moment when our brain and body really needs to switch off and reduce that external stimulus. So, and the other thing is that because lights are engineered cheaply and we're dealing with some legacy fitting, so the wiring, I'm in a very old building and the wiring was designed for incandescent bulbs, and an electrician who doesn't understand how this stuff works will install a dimmer switch or a driver which isn't compatible with the light. So we get some really substantial flicker problems. There's a whole bunch of stuff which mean that LEDs aren't great. And I think there's another comment about lighting design that we in the past all we had access to was a thing dangling from the middle of the room, and so most houses are still built either with a pendant, a thing dangling from the middle of the room, or the modern equivalent, which is a bulkhead stuck in the ceiling in the middle, or with kind of a grid of downlights, which are usually drilled up into the convenience of the lighting of the electrician, really. So I think the way we are, the kind of legacy rolling forward of just replacing like for like needs to be challenged, and we need to think about what we can do. But it's what we've got. We're not going back to incandescent. We can add a halogen lamp, as Glenn suggests, to our desk to kind of give us some of that infrared. But this genie's out of the bottle. It's like saying no more AI. That's not how the world we live in. And actually, as Fanny was saying, there are some amazing benefits from well-designed, properly controlled LEDs in terms of our environmental impact. So it's to do with using what we, choosing wisely, buying once and buying well, and being a bit more demanding about the lights that just get chucked up into the spaces where not only us but also people that we care for find themselves in difficult situations. So does that answer the question?
Hopefully that answers the person's question. Yeah, thank you. That was very, very thorough. And for more resources as well, I should say, on our website, for more resources on lighting and a whole range of other elements around more therapeutic environments, you can have a look at our environment hub, which was developed by NHS England South West, along with one of our other associates, Liz Lavender, which provides a whole kind of host of kind of easy to read, quick overviews of from lighting to sound to colour. So I'll put that in the chat as well. But while I'm doing that, let's just see who else has put stuff in the Q&A. What about flickers and how that affects our health? That's a really good question.
Yeah, so I'll just jump in and answer that one as well. Your brain evolved to kind of under the sort of relatively steady sunlight, and it also evolved to spot threats from things which are moving, particularly in our peripheral vision. So, and there is a frequency, a speed of change that we are physically aware of at around, I think the flicker fusion frequency is between 60 and 90 cycles per second. So it's quite quick, but what we now know is that levels much higher than that. One study found up to 10,000 cycles per second still changed the amount of blood flowing to the retina, it changed heart rate. And so it has a profound effect, particularly for people who are already feeling anxious, because obviously your that kind of hypervigilance is a real concern. So that's, yeah, it's a real problem. And thinking about good quality lights, good quality drivers and control. So you've got, I'm going to be geeky here, but you've got alternating current coming in through the wall, and it needs to be chopped up into direct current to feed electrons through the LED. And that's why you have the old-fashioned incandescent lights. They took the alternating current and that was fine. Fluorescent lights take the alternating current and store it up in a ballast and then fire it through the vacuum of the tube, a compact fluorescent or a long one. But now what we have is the alternating current coming in and through a driver. Now that's either an external box, which you may be familiar with, or it's built into the base of the light bulb. Like you'll see some of the light bulbs bases are now getting bigger and bigger. Well, they're actually getting smaller again, but for a while they were quite big, because all of that technology to chop up quite a lot of power into something that the LED chip can handle is placed there. So you need to make sure that and then you've got the control in between, the switch in between. So making sure that the switch and the driver and the LED are all talking correctly, are all managing that power correctly, is absolutely critical to making sure that the power doesn't end up sort of jumping about as it comes into the LED. So that's why we talk about flicker being a problem, because a good quality, a well-configured system, a well-commissioned system doesn't have, I mean, it's got flicker inevitably because you're chopping up an alternating current, but not at a level that's problematic for the brain. When the system starts to break down, you end up with this kind of jump, which is a stressor. It also reduces reading performance. It reduces a bunch of other stuff as well. So yeah, flicker's a problem, and it's an avoidable one.
That's definitely quote of the day. Flicker's a problem. Thank you. Right, scanning through. I also had a question while I'm just having a look for Fanny, actually, around kind of preparing early to make the case for lighting. I wondered if you had any comments, because you've talked lots about the kind of opportunities, but you also talked about the kind of competing demands. And I just wondered if you had any kind of thoughts on how to kind of, balance the challenges of many different aspects of the environment needing to be cared for, and to meet both kind of net zero targets, but also needing sustaining or refurbing. So yeah, I just wondered if you had any thoughts on that in your experience.
Yeah, I think there's huge opportunities, and as I mentioned during the presentation, I think that the numbers really can add up in terms of, you know, reducing financial the bills, sort of reducing the financial impact, but also kind of reducing emissions. It's really interesting to bring the science around lighting, you know, what kind of lights and actually how many. I've experienced often sort of replacing existing bulbs and lighting with LED, but actually the question is, do we really need that many? Do we really need them there? Is that the kind of light that is needed? And actually, you know, was putting some new lights or LED or you know, reconsidering a project such as this one is really sort of thinking about it from a concept perspective. Actually, wouldn't it be better to put some lights that I've got sort of asset tags that can be managed, that can be linked to sensors, so they don't need to always be on, or they can be dimmed, and thinking about that. There are some challenges. I think some of the ones I'm thinking about is, you know, access to funding, and sometimes it's really difficult because some of these projects, thinking about such huge healthcare spaces can be costly, and it's just thinking in advance. And I think one of the things that is really important to consider is starting to think about it, starting to build the case. You know, it could be that just doing some surveys or working with some contractors to understand what is the cost of it, what are the potential benefits, because that will help you to then build your case, build your business case, whether that's for internal funding within your organization, or actually access external funding. There's also some cases of kind of performance management that do not require capital cost or capital funding upfront, and we see those more and more coming. So those are things that can be considered to try to sort of overcome this kind of funding issue. But ultimately, we're also talking about, you know, live healthcare settings, and going to change a lighting, a bulb, or redesigning how the lightings are going to be introduced in the ceiling and sensors associated in a clinical environment with live pressure is a real challenge. It's not just going into the office and actually changing it. So it's really working with stakeholders to understand the needs and then understand how that can actually be implemented. And those are the real challenges that we face as a healthcare system. And it's worthwhile thinking about it from a concept perspective and hearing the needs of the users as much as possible. If that's helpful.
Yeah, thank you. That's really, really comprehensive. And thinking earlier about business cases is a really useful reminder. There's a question about the community, which I think is really important, because when we're talking about mental health environments where we experience mental health, either care or just our own experiences, might be worth us just having a look at the question around Richard's leading design for a pilot project, which is moving mental health services into the community, in this case a Victorian community centre, which is with its challenges. And then I think Ruth has also put, is there a recommendation? She's in people's homes, and are there light bulb recommendations for different rooms? So two questions, really recognising that mental health services are delivered across the community, there's support within people's homes. So maybe if there's just any reflections from our speakers on looking particularly at those community home environments.
I mean, I can maybe speak a little bit to that, because people are often getting in touch about, you know, granny flats and those sorts of things. So I think the first thing is to think that maybe the light fitting above or the downlight shouldn't be considered to be your only route to lighting a room. So a number of my mum's friends and stuff, we've basically installed IKEA panels on the walls, or found other standalone things which deliver the light levels they need to set their body clocks during the day. And certainly in my mum's house, we've installed strips around the bathroom door, which activate when she wakes up. So she's got some, just sort of thinking in very, very practical terms about how a space is used and which, where the key touch points in somebody's day are, so that we can move away from a kind of a single bald fitting in the ceiling, which makes them look grey and old and feel miserable, to something which is much more supportive and friendly. There are also some really great USB rechargeable lamps, which mean that you haven't got trailing stuff to trip over. So you can add, one of my sister's husband likes it really bright, she likes it really soft and warm. So we've got some of those on one end of the dining table, so that they can each modify the way they want to live in that space. So I think being imaginative and thinking laterally about what's possible, and then finding fittings which in the ceiling, in residential care at the moment, we're working with fittings which allow you to create scenes. So in hospice at the moment, looking at a scene which is a soft setting and a focus setting and a cleaning setting. So I think just kind of replacing the light bulb in the ceiling isn't, and I think one of the comments in the chat was that just replacing light for light ends up with sort of just a bunch of light in the middle of the room, and not that kind of that more intuitive and comfortable and sort of uplifting way of thinking about stuff. So and I mean, I've actually starting to set up an Amazon shopping list of good quality light bulbs, which are worth looking at. So maybe reach out and I'll share that link with you as well.
Yeah, thanks, Shelley. That's great. And Liz has put, think of lighting in layers from the ground up.
Exactly right.
And
yeah.
I've just reflected on some of the other comments, which is about how the space feels to use. And
I think something else I often find is that people they've got their sofa kind of with the back against the window, for example. I mean, just some very simple ways of making more of windows, so that you make the most of all those wavelengths, and actually it's free. So from an environmental perspective, it's great as well. So making sure that there's windows or kind of easy ways of getting a breath of fresh air is something else that makes a massive difference.
And we know the evidence is there around also just improve health outcomes when you're in recovery around being near to natural light, if you can't get outdoors. But I think there's a great opportunity in the community to use lighting as much more of a tool to creating better health and mental health environments. And we've also got some good chat going on here. Don't forget, lighting should be designed and by someone who's looking at bringing in experience. So yeah, I think it's, when thinking about lighting, there's a number of stakeholders that are involved. So people with lived experience, or people experiencing the lighting, designers, clinicians, estates, depending on the environment you're working in. So it's like anything, it's a multi-stakeholder endeavour.
Yeah, I mean, Lorraine, you're absolutely right. I mean, you in the same way that you wouldn't design, you might go to Curry's and have a look for a computer, but actually, if you're going to design, a system, an IT system that's going to be reliable and sustainable and affordable, you'd be better off having a conversation with somebody who's done this before, and can help to guide you through that process. So absolutely, there are levels of intervention, and I think the minute you start to look at a more kind of systems approach, then working with the professional is really it's a false economy to try and DIY everything.
Neighbourhood mental health teams being formed, a real opportunity to get lighting right and fit for purpose. Yeah, thank you, Richard, for saying that. That I do think that there is a really great opportunity to use lighting to support the neighbourhood mental health centres that are being invested in. So yeah, thank you for that. There's a quick one about, did we mention an Amazon list for light bulbs, and how do we get it, Shelley? I'm thinking you might have mentioned that somewhere.
Yeah. I'll send a link to Michelle, and she can. Basically, I've got a sort of a list of the filters that you need when you kind of find yourself on Amazon or similar sites. So I'll share that with Michelle as another slide, and then you can have a look at that.
Yeah, Thank you, Shelley. That's brilliant. We'll make sure that we can send a link out to the slides, and we'll add that as part of. So just please make sure you've signed up in the link earlier on to make sure that we'll email it all to you. Thank you. I think, is there any more questions? I'm just having a quick look in the chat. I'm using Michelle's put the links. I just want to, yeah, with my estates hat on, we often forget to consider the future maintenance and repair. So thank you, Magnus, for that comment. So just, yeah, again, like really helpful reminder around thinking about maintenance, repair, availability of spares when designing lighting systems. So that's a really useful top tip from someone who is thinking about this. And then some comments about changing lights. Oh, it's all going mad now, which is great. Right, I'm going to draw it to an end. We will make sure we send out the link to the slides in due course, and then we will get them on our website. Thank you massively to all of our speakers, Shelley, Lee and Fanny. Thank you to all of you for attending and showing interest and sharing your experience of this session. And until next time, we'll draw it to a close. So thank you.